Hello, my name is Fashalli Giovi Bilhaq. You can call me Fashalli. I'm a biomedical engineering student of Airlangga University, Surabaya, Indonesia. This idea project is my final assignment of Intelligent Systems course. So before we reach the idea, let's begin with its background. What is heart failure? From the National Center for Biotechnology Information Advanced Sciences and Health, or NCBI, defined heart failure as a common and complex clinical syndrome that results from any functional or structural heart disorder, impairing ventricular filling or ejection of blood to the systemic circulation to meet the body's needs. Pretty complex, isn't it? So in summary, the heart failure is a term used to describe a heart that cannot keep up with its workload, resulting the body may not get sufficient amount of oxygen. At first, the heart tries to make up for this by enlarging, stretches itself to contract more strongly and keep up with the demand to pump more blood. Over time, this causes the heart to become enlarged. And then developing more muscle mass. There will be increment in muscle mass caused by the contracting cells of the heart getting bigger, and this lets the heart pump more strongly, at least initially. And pumping faster, this helps increase the heart's output. The body also tries to compensate in other ways. First, the blood vessels narrow to keep the blood pressure up, and trying to make up for the heart's loss of power. Then the body diverts blood away from less important tissues and organs, like kidneys. These temporary measures mask the problem of heart failure, but they don't solve it. Heart failure continues and worsens until these compensating processes no longer work. Eventually, the heart and body just can't keep up, and the person experiences the fatigue, breathing problems, or other symptoms that usually prompt a trip to the doctor. Now, this is the animation of heart at its normal condition with strong muscular walls, as you can see. And this is the heart failure condition. You can see on the left ventricle, its muscle wall is getting thinner and weaker, and there is a flow back of blood. So the blood is not pumped efficiently. Now, the body's compensation mechanism help explain why some people may not become aware of their condition until years after years and their heart begins to decline. Heart failure can involve the heart's left side or the right side or both sides. However, it usually affects the left side first. And it is a terminal illness, means that it cannot be cured and have to be treated over the patient's lifetime. From American Heart Association stated that heart failure is a serious condition and usually there's no cure. But many people with heart failure lead a full, enjoyable life when condition is managed with heart failure medications and healthy lifestyle changes. Right, so what causes heart failure? Heart failure is caused by many conditions that damage the heart muscle, including coronary artery disease, heart attack, cardiomyopathy, and other conditions that overwork the heart, like the high blood pressure, valve disease, thyroid disease, kidney disease, and diabetes, etc. There are 4 stages of heart failure from stage A, the pre-heart failure, that covering people at high risk of developing heart failure, to stage D, for patients with systolic heart failure and presence of advanced symptoms after receiving optimal medical care. Each of these stages needs some different treatments, but it all needs to be monitored. There are several major signs or symptoms of heart failure that you can feel or see, like congested lungs, your hard to breathe, and the fluid and water retention of your body, and dizziness, fatigue, weakness, and rapid or irregular heartbeats. Now, if this is a terminal illness and it's most likely cannot be cured, so what is the problem? So, since it cannot be cured, you have to monitor the process of the patient time by time. Now, the monitoring process is available in hospital, not limiting patients' mobility. And there is some additional problem that mostly the cases found when the patient is having some declined heart, already experiencing heart failure. So there are less likely patients that proactively check themselves and prevent, or at least reduce the effect of heart failure. Now it's raining. Right. So why does it matter and have to be solved? If the heart failure doesn't treat it seriously, it will cause systemic problem to other body organs, like if I could say the worst case is death, and there are some major organs failure like kidneys, or mostly kidneys. So in this project, idea project, there is a solution that I propose is to have a compact monitoring device for monitoring the significance parameters or vital signs at home. Since heart failure is characterized by high admission rates, and in patients with advanced syndrome, the patient will have elevated heart rate and dyspnea, or lower oxygen saturation of blood. Both of these vital signs are closely associated with high mortality and morbidity. The symptoms are added in the body day by day. The early detection of heart failure has an advantage to prevent or reduce mortality rate by warning the patients or user, so the user realizes the risk of heart failure and make behavioral change with his or her life. For the heart failure patients, the therapy should be done with some phases and periodical updates on patient conditions. Now, the idea that I propose is a wearable monitoring device that allows the system to monitor your vital signs, including heart rate, blood pressure, and blood oxygen saturation, and give an alert if the vital signs pass some thresholds. So, first, if I want to realize this project, this idea to develop a portable wearable device to detect an early stage of heart failure and to monitor heart failure patients using some sensors. There are several sensors that I'm gonna use. The first sensor is pulse rate sensor to monitor your heart rate, and portable 1-lead electrocardiogram to measure your heart rate variability, and photoplastimogram to measure blood pressure and oxygen saturation, and of course a gyroscope to check patient's condition. The data will be processed in cloud with supervised machine learning using decision tree algorithm to give a real-time warning to patient with his or her condition. The data measurement will be done periodically with each interval 10 minutes. In this device, there's a supervised classification algorithm that I said before. The decision tree will be implemented to classify users' vital signs. At first, however, the patient needs to get anamnesis from the cardiologist to set up some parameters. Then the data will be fed from patient's tests, including working states such as doing high and light intensity exercise, resting states, and sleeping. The data needs to be labeled at first time but by the user's assistant, if there is, to set the system threshold. The AI learning mechanism will be knowledge-driven. After 3 days of data mining, the system will process the data in cloud and gives a specific value of threshold to the device. When the system is ready to be used, the patient's doctor will be notified and the at-home monitoring, aka telemonitoring, is started. If the patient's vital signs pass the thresholds, the doctor and patient assistant will be notified. The doctor will call the patient immediately to do some anamnesis. If the patient's vital signs drop significantly, the system will call the nearest ambulance and activate patient's location to give immediate treatment. Now, this device is targeted for the stage A patients, the pre-heart failure patients, because this might be the sicker people with moderate symptoms, but they want to be proactive about their life, their health. Then they can, because they could slide into worsening heart failure over just days or weeks without realizing it. So the idea is to prevent major health failure and focus of long-term healthcare. This application base of the device is combining smartphone application, cloud computing, and web application. It allows users to check his vital signs via smartphone, and the doctor could monitor patients' vital signs via web app. So that is my idea about heart failure monitoring device and system. If you have things to be criticized, or I think will be my pleasure if you share your thoughts in the comment section below. Thank you.